Thank you so much for joining me as my guest on More Than Lipstick. And I know that we have been trying, Shakana, for several weeks now to get this on the calendar. So I'm super excited to have you. And the topic that we're going to be talking about today is incredibly important. And it's totally in line with the More Than Lipstick brand as we talk about things that impact Black women, women of color, our lived experience. And I am just delighted to be able to to speak on this topic today. So thank you so much for joining me.
You're welcome.
So, for my audience, I would love for you to share little bit about you, give us a little bit of your background, and in addition to that, would love to understand a little bit more on what drove you to write this book of You Will Live.
So, once again, thank you for introducing me. I am Shakana Hall. I've been a nurse for over 25 years,
Mhm.
and I also work as a nurse practitioner. And during the course of when I moved here to Central Florida, actually in 1999, I didn't know anyone. So I was starting from scratch. But one of the things that I really, really love is that as I started my nursing career, I was able to see so much. So you're
Mhm.
young, you're starting your nursing career, and you're starting to put, like they say, the big puzzle together. So, one of the things that I truly love is in my nursing career, I was exposed to so much. I
Mhm.
worked on, at that time, we had the HIV AIDS floor. I worked on the TB, tuberculosis floor. Also worked med surge, taking care of the patients who couldn't speak that was on
Mhm.
ventilators. And so I will also a float nurse, orthopedic, I worked there. And then finally I was like, I want to go back to where I love when I was in nursing school at Florida A&M University.
Yeah.
That was maternal health.
Mhm.
So I went and I applied for maternal health, and the lady at the time was like, "No," I said, "I want to be a float nurse. I want to learn everything." And she was like, "No, you have." I said, "I want to learn one thing." And I'm like,
Mhm.
"Hmm." So she gave me the opportunity. And when she gave me the opportunity, I was so excited. And guess what? I
That's
started learning everything.
mhm.
So during my career with obstetrics, mother baby, going to deliveries and helping everywhere and learning and my skills, I started seeing a trend. I would see more and more ladies that would come in that didn't understand their care. I would see where we did have some, unfortunately, that would pass away. You will have a baby that no longer have a mom, or I will have a mom that no longer have a baby. And so I started doing my research is the whys. And that is the one thing that drove me to You Will Live.
Mhm.
So I did lose a couple people that I did know. I did lose one person that I knew personally after giving birth. And so that was very saddened for me and for others. But it's starting to dive in is what is missing?
Mhm.
How can we help solve the problem?
Mhm.
And what can we do to make it better?
Yes.
Um, Real quick, in 2021, my father passed, but also I had a cornea transplant. And during that time when I could not see because your eyes are patched, and you would sit on the sofa or you're just lounging around, but you had that time to think.
Mhm.
And my husband or my son would press the note section on the phone. And so I would speak. And I was like, oh, you know what? I'm going to write a book
Mhm.
and put all of my thoughts together. And so I just thought about where my purpose at that time was really, really blossom. And I was like, oh, that's it. That's my purpose. And then the last important thing it is, let's put this together so we can create something tangible so we can teach, educate, and empower everyone. And so that's how You Would Live was birthed.
I love that. I love your story. I love the what I'm excited to hear and what excited me in terms of your journey is that you have had so much exposure to so many different areas within medicine, within nursing. And so all of that knowledge that you have gained and learned and become an expert in, and then you get to your purpose, it all comes together and you can see such a bigger picture. And I think that that is a skill, and that is extremely critical because sometimes people are specialized in one area and they're not able to see left or right. And
Hmm.
so for you to be able to see all of that and bring it together because of your journey, I think is brilliant. And so well done, intentionally or
Thank
not.
you.
That's just amazing. I love to hear things like that. And so you touched on quite a few topics that I want to dive into. And as I was doing my research, and you spoke on the fact that you started seeing a trend. And one of the things that, as I was doing my research, when we think about the Black maternal health and mortality crisis, because in fact it is a crisis. And as I was looking at the statistics, and I have girlfriends, I understand I've been in, the hospital for different types of care, but I've always had my advocate with me. But to see these numbers is alarming. And it says in 2023, Black women in the US died from pregnancy related causes at 50.3 per 100,000 births. And that is more than three times our counterparts, white women, and we are amongst the highest rated in any racial group. So that was astonishing to me. And then, in comparison to, in the US, we're leading, in comparison to Canada and Switzerland and France. I mean, Switzerland is at 1.2. And, so the numbers are very staggering. But not only that, it is, as you said, you've lost someone. And then when we look at the impact, over 70% of Black women are the breadwinners, or in many cases, the solo breadwinners, 70%. So if we are losing our mothers in childbirth or in post birth, then we're now impacting the entire family of a loss, financial displacement of children. And as you just said, either a baby with no mom or a mom with no baby. And now that's alarming. And it actually definitely defines as a crisis for me. But there are things that we're doing. We're looking at those preventative measures. You're writing books. We're coming on the podcast, and we're talking about things like this to bring that awareness. And I want to talk to you a little bit more about your book. And in addition to that, when you think about the experience of a Black woman in today's healthcare systems, especially around pregnancy, what are your feelings and thoughts? What are some of the first feelings and thoughts that come to mind?
Sadness,
Hmm.
scariness, and what else? You just think about what else can we do to save their lives.
Yes.
But it's very scary. So you started mentioning it. The United States is one of the highest number for mortality, but we also one of the richest countries. So you
Yes.
start thinking about why do you have one of the richest countries having higher mortality rates? So
Yes.
you mentioned Switzerland. Switzerland healthcare is totally different. And Switzerland also has less African Americans there, less
Absolutely.
Hispanics there.
Hmm.
So that is also why their numbers are better. So when you think about the African American woman, when you think about the minorities, it's scary.
Yes.
And when we have someone that is pregnant, they must be also, you mentioned it, have an advocate. They also must not only read the book for themselves, but they also must have the spouse and the caregiver who's going to be in the house with them understand the book,
Yes.
understand what to look out for when they get home.
Yes.
If they cannot speak, you need someone to be able to speak for them. But I look
Hmm.
at myself. I had a book I started reading. Oh, this is good information. Oh, yes, I know to look out for this, but I never shared it with anyone.
Hmm.
I never shared it with who's going to be my caregiver. I never shared it with I just did not because it talks about to the woman.
Yes.
So what happened when that woman can't speak? What happened when the crisis come and she's looking around for help? Where do it tell you to reach out to your community?
Right.
So growing up, we were taught what stays in the house,
Hmm.
Whatever goes on in the house stays in the
Stays in the
house.
house. Yes.
But what
Yes.
happened is, what if in that household is someone there that you can't trust? Who do you tell? And back in the day is you can't tell anyone.
Hmm.
But now we need to go back to before when we had community, where we knew our neighbor. We need to go back that if something's wrong with me, I feel comfortable talking to someone. I have to have someone I trust.
Yes.
So current state, when you look about and think about statistics and what's happening, it is saddened for us, but it's also where we need to now arm and learn our tools, how to speak up for ourselves, how to get back to the community, and how to join forces so we can help one another.
Absolutely. I think with everything that's going on in our country today, that we're having to get back to not just the basics, but the basics of old school. Like it is
Mhm.
required. Oftentimes, because we are the breadwinners, number one, we don't get the privilege of staying in bed and staying in the house for 6 weeks because we're just now beginning to get laws or companies are taking it upon themselves to
Mhm.
implement longer maternity and paternity leaves for both the father and the mother, right? So there are so many things that have changed in our society where we no longer do that, and it is very sad. I had the benefit and the opportunity to travel a lot in my previous role, and I spent time in South Africa and just
Mhm.
learning and seeing the traditions and how the mother was cared for and she stayed in bed and the mothers of the community fed her and nurtured her and helped her heal right before, and then someone else was responsible for taking care of the baby, but she would be there to nurse and to love. But it's completely different,
Mhm.
and in order for us to be able to survive, we are in fact going to have, like you said, look at going back to community and some of those practices. What does it look like for us within the Black community and trusting the healthcare system? Or what does that look like for us?
So, in order to trust the healthcare system,
Mhm.
we're going to have to learn what to look out for. So, that goes back to your very first appointment. It is, you're so excited, you're having a baby, you go to your very first appointment. And if you don't get that trust right away, or if
Mhm.
you do not feel that trust when your excitement is so high, but yet the provider come in and not excited, not happy, that's your first red flag.
Mhm.
If you cannot establish trust within the first 2 to 3 visits, then you know you need to leave. So with that being said, is trust number one. If we go back to community, community talks. They will say, "Oh, I went to this provider and they were
Mhm.
great. I had a midwife. She was awesome. I used this doula to help me get through labor. They were awesome." So it goes back to connection and it also goes back to referral. So my thing is, if you don't have that trust, you can move to a new city like I did and don't know anyone.
Mhm.
But when you go to that doctor visit, before you go, you research
Right.
and find someone until you like the one you have. I can tell you there is a push for African Americans to support one another.
Yes.
Find a provider that look like you, that you can explain things to and be yourself.
Yes.
If you have a provider where you can go in and have questions and you talk to them and you can make a connection and you don't feel like, oh, who is this? Oh, why does
Mhm.
she have this? And you do not feel rush and you're able to establish trust, that's who you need.
Mhm. Representation matters.
Representation matters.
Absolutely. 100%. And and for that reason, because oftentimes as Black women, our pains and our symptoms when we are sharing are overlooked or they're explained away or they're minimized. And that is not a feeling, that is fact, right?
Fact.
That is fact. And that goes way back into when we were enslaved, that they thought that for whatever reason we had this ridiculous intolerance of pain or high threshold for pain, and it is now seeped into the modern day healthcare. And it doesn't matter, from what I understand, like it doesn't matter your socioeconomic status. Yes, in our poor communities, in our Black poor communities, there is definitely impact, right? But to be heard and to be seen, it doesn't matter if you're in a certain income bracket or not. It's often overlooked. And I mean, is
Yes.
that okay?
So
And
I'll
that,
tell you this. The one thing that I did as I started learning, there is a book that talk about culture
hmm
in the obstetrics world.
okay.
So I'll tell you this. If you have an Asian patient,
hmm
she gives birth.
hmm
98% of them do not want any cold water. We'll bring you
hmm
water. We try to give you
Yes.
juice. No, they want hot tea and hot soup.
hmm
That's their culture.
hmm
And their family will bring it in. So
hmm
it's very important when they come that you connect with them and their family.
Yes.
If you have a Haitian mom, I can be walking down the corridor and I can hear this click click. I know that the woman in that bed, 9 times out of 10, is Haitian Creole.
hmm
That's what they do when they have pain. From my
Mm,
experience, and it's written. I can walk down, I can go in there, and I can see. So I think as healthcare providers, if we go back to the basics and start reading and learn
hmm
about culture,
Yes.
you can be prepared when you have that patient.
Yes.
With that being said, that's one of the things with my business. I created a birth plan. So that way they can start planning ahead of time what and how, what I want to do during delivery. I
hmm
want you to ask me if need an epidural. I don't want you to ask me because that's a distraction. If
hmm
I'm a mom and I want to be all natural, you don't start at delivery. You start in the beginning. It's like learning everything you can do. It's just like learning, like I'm going to run a marathon in
hmm
June. I'm going to have a baby in June. So I
hmm
start learning what I need. So that way I prepare for when the time come. I already know how to endure the pain. I already know what my distractions are. I know I want the ball and I want to sit. But
hmm
it goes back to healthcare providers learning their patients. So you got to have that connection and trust,
Yes.
communication. And it's also going back to healthcare providers knowing culture.
Yes. Yes, absolutely. I wrote that down in big letters on my paper here, that it is definitely about culture, and because it's not a monolithic delivery, and we are not, as women of color, as Black women, we're not all the same.
No.
And being able to understand that, but that has to be a part of, now this is where, the Nicole Lauria consulting hat comes in. That's the training, right? That's the gap. Because if we're expecting people to just on their own, there will be a population of people that will have an interest, and they will do research, and they will want to understand and learn. But other people are going to be very clinical, and this is the process that they're going to do. And some of those that are going through that process and not willing to cross over may have some unconscious biases that they're not even aware of, or in certain cases, maybe even not even overt biases, but may have some biases. So then you're contending with those issues as well, those dynamics, as you are, like you said, discovering and identifying the appropriate caregiver. And that's just going through and I'm not medical, so help me out here, but that's
It's
just
okay.
going through the 9 months. And then there's the delivery, and then there's the post delivery. And you may have a fantastic doctor, but those nurses, after the baby has been delivered, it's now the staff that are really the first line of awareness if there's something that's going on, and they have to be able to recognize that. To your point, it
Mhm.
goes back to the culture. Hmm.
Yes.
Okay. All right.